Hello, everyone. I'm Camellia. As most of you have followed me and subscribed to this channel, I am a psychiatric mental health nurse practitioner, also known as a PMHNP. I'm also a nursing and mental health enthusiast. And so a lot of what I've done over the past few videos is just really expressed different angles of the PMHNP role. And so I'm still endeavoring to do that. And I've had some questions along the way that have prompted these next few videos. But I'm now endeavoring to focus in on the psychiatric interview. There are lots of references out there about how to do a psychiatric interview. But really what I want to do, and I'm endeavoring to do, is to sort of chunk the psychiatric interview over a few videos. And my goal with that is to be able to show you guys how I get from beginning to end with a patient before I talk about a treatment plan. And so, again, there's lots of resources and references about how to perform a psychiatric interview. But I'll tell you what prompted me to consider this. First, I had one of you to ask if I could do a mock interview with a patient. And instead of doing that right away, I thought, it's probably best that I sort of backtrack a little bit and think about and really share the information about how do I get from point A to point B when I'm asking these questions to patients. It's also important because I'm actually working in a position right now where patient load has really increased, and I've had to figure out a way to be more efficient while also obtaining the necessary and appropriate information to gain what I need as the provider from the patient to really guide their care and to be able to provide high quality care for patients. And so I've had to really look at this over a little bit of time here and really cluster and start clustering questions and how I ask things, and also keeping a balance of what I'm asking and giving the patient time to respond, but also helping them to understand and know that I'm listening. And so there's a delicate balance that you have as a provider in mental health. And so a few things that I will talk about for this video, just as an introduction. Again, each video is going to be about a different category of the psychiatric interview. But I do want to focus in on a couple of things. The first thing when you are doing a psychiatric interview, of course, it will typically be for a patient that you've never seen or that you are not very familiar with. And so the purpose of the psychiatric interview is for you to get the information needed that's appropriate, that will help to provide a treatment plan and to provide, care for that patient. And so what's important is that you get accurate information, that you get the most information and the most detailed information from that patient. And so what is also one thing to consider before you get into the psychiatric interview is the time that you are going to need for that. So in most organizations, 45 minutes to an hour is considered the amount of time that is necessary for you to perform an initial visit, a psychiatric interview during an initial visit. I will tell you that if you're used to working with adolescents or you're used to working with children, you are going to spend more time. So it's not uncommon to actually have allotted about usually 90 minutes or so, an hour and a half, to obtain information from both the patient and have time to obtain information from the family. And what's important about that is that there are most times where you are looking at family dynamics to really help to derive the best plan for either a pediatric patient and or, of course, an adolescent. So given the time, you want to be sure that you use that most efficiently, and you are considerate of that before you pursue the psychiatric interview. There are times where you're not going to feel like you have enough time, and you may have to schedule follow-up visits for the patient, subsequent visits to really gain more information. The other thing I would like to point out here is that this initial visit, this psychiatric interview, is really the foundation of what you will develop over time in terms of the rapport with the patient. I talked about active listening before and how that's important in mental health. Keeping in mind that many patients have avoided coming to you for a while for many different reasons, whether it's that they don't want to talk about what they have going on, they've been taught not to talk about it, they don't feel like they've gotten the right support, or they maybe have gone to a different provider and haven't had the best experience. So all of those things you will find as a psychiatric provider. And so what's important is that you really take time on this first visit to actively listen to the patient and understand that this is your basis for building trust and rapport with the patient. So that does require you to let the patient do more of the talking. This may take some time and practice with, but really you're just prompting questions and using the questions that I'm going to talk about over the next few videos to really help to determine where you need to steer the patient. Most patients know their information, with the exception of some of the medical things like medications and names of medications and dosages. But for the most part, they know that their path to getting to you. And so you just want to give them the ability to have a space where they can talk about that within reason and also within a reasonable time. But again, you may have to sort of build on some of these things that I'll talk about over time because you may not have enough time for that initial visit. And really focus in on why is this important? It's important because it helps to drive a treatment plan for the patient that may be beneficial for the patient to help mitigate what they're dealing with and what they're managing and trying to cope with. Okay. The other thing I would say is to let the patient know what you are doing and why you're asking these questions. So I do find myself a lot telling patients that's important to help me get a better understanding. I'm asking you this to help get a better understanding. When you start asking patients about things like trauma and things that they are not as comfortable with talking about, they may get a little bit more apprehensive about offering the information and answers to those questions. And so you really want to be really open and upfront with the patient and say, I'm asking this because it gives me some context for your history, which will help us to come up with a treatment plan together. So just letting the patient know exactly why you are asking these questions. Pay attention to body language. If you notice that a patient's body language changes when you are asking specific questions, do hone in on that a little bit and say, I noticed that you changed or you had a different response when I asked that question. Can you tell me more about what you may be thinking? Things like that where you can pay attention to cues. Patients are not going to always tell you everything. A lot of what they'll tell you is through their body language. So that's another thing that I will offer with the psychiatric interview. I am referring to my notes here a little bit, but really the goal of this series is to really chunk the psychiatric interview into a few videos so that I can spell out exactly what questions I ask when I talk to patients, and so that you guys can get a clearer idea of where and how I get from point A to point B. With providing mental health care and quality mental health care, but also to a point where patients feel like they can trust you. And of course, over time, that you've developed a positive rapport with the patient. So maybe some of you have had these experiences and some of the questions that I'm going to be showing and sharing with you guys. But most of you, some of you may be practicing already. Maybe you're not at PMHNP, but you are working in healthcare. Maybe you're a nurse, a nursing student. Maybe you are a PMHNP student, and you have found other ways as well. So throughout this series, I do want to engage with you guys a little bit more, and I do want to hear from you. I want to hear what's worked for you, what hasn't worked for you, and so that we can all sort of use this space to share with the common goal of promoting the best care for our patients. So again, look out for the next video. I will be talking about how I introduce myself to a patient, and then I'll be talking about how I obtain and explore a patient's psychiatric history. So more to come over the next few weeks. Thank you guys for listening, and please feel free to comment or ask me any questions below. Thank you.